Dr. Grillo, nurse practitioner with Refresh. Today I am here with Becca, who's going to be receiving her first dermal filler treatment. Becca's in her 30s and has had Botox, but today we're actually going to be giving her a little lift in her mid-face and giving her a little more cheek contour. So this will be a great way to start preventatively. We're going to be using Voluma, which is Allergan's up to 2-year duration filler. So the great thing is, Becca, once you've had this treatment, you're not going to need to have this done for another couple of years. We'll get started. I've mapped Becca in areas that I think she would benefit from the Voluma, and I also am using our AccuVein, and it's a little bright to see in this lighting, but this is going to help me look at blood vessels to avoid, to help reduce bruising for her. And then before we get started, Becca, you'll feel me cleaning your skin with this little prep lotion. Also icing you for comfort. Just completed half of Becca's mid-face with Voluma. I've done 1.5 syringes, and the things that we look for as aesthetic experts, we look for symmetry and balance, but really it's really more about harmony and balance, the concept of 5. No one's face is perfectly a set of twins or siblings. But you can see here the difference in the side of her face. Not only in more of an outer cheek contour, there's less flattening in the mid-face. Her lower face looks as though we've lifted it, even though it didn't look like it needed it before. And it's just a very soft subliminal difference, and that's our goal. The other thing that it improves is, if patients have it, is the nasolabial folds, because it's lifting. We're treating the cause rather than the symptom of the cause, and even the infraorbital or under eye hollows. And Beck, I know you haven't looked yet, so if you want to take the mirror and kind of hold that farther away from yourself so you can really see. Yeah. Tell me what you see.
Very much more lifted.
So one thing we're looking for is the contour change. When we look from the chin up to the cheek, we can really see the difference, and patients can see that as we compare it to the non-treated side. Becca, take a peek at that. That lift. So we'll move on to the second side. We've prepped and marked Becca for her second side. I like to start on the side that's more deficient, and I felt this her right side was, so now we're going to begin on her left. I've already prepped her, and I'm going to start, Becca, just right here. Becca, you did phenomenal for a newbie, and even for not a newbie. So if you take the mirror, you can see what we did with the 3 syringes of Voluma. What do you think so far?
Love it. Amazing.
So, well, good. And you know what I tell all my patients is, afterward, you see your result, but you're going to see your results like a good wine. It ages with time. So over the next 2 to 4 weeks, you're going to continue to see improvements in the contouring, and we'll want to see you back at about 3 weeks or so have to evaluate where you're at, determine if we're happy with those 3 syringes or if we want to do any more contouring. We could even add another syringe. And then the aftercare, pretty simple, but basically you want to avoid anything that would increase blood pressure in your head and neck area. So having any exercise tonight, any alcohol, avoid things that would involve pressure. I would like you to avoid sleeping on your sides. We have some great anti-aging pillows. One is right behind you. It's called the Envy pillow, and it gives great support to the neck, and it also is great for side sleepers because it doesn't allow that pressure in that area that we just treated, and it really does help. And then also you're going to be icing afterward, and we'll give you some ice to take with you, and then you're supposed to get instructions. I look forward to seeing you at your follow-up.
Thank you.